Seema is a postmenopausal 60-year-old woman and mother of two who was diagnosed with hormone receptor positive breast cancer last year after an abnormal screening mammogram and biopsy. She had a lumpectomy and radiation and is currently on endocrine therapy with the aromatase inhibitor anastrozole. She comes to the appointment today with her husband.
Hello, doctor. Thanks for seeing me. I think I'm doing okay.
I'm glad to hear that. You started a new medication, anastrozole, since I last saw you. How have you been feeling since starting this?
I think it makes me more tired. Do you think that's a new medicine? My family is very worried and has a lot of questions, but I can't remember them all when I get here. That's why my husband comes with me. Sorry, maybe I should be asking my oncologist these questions.
Patients are often confused about where to direct questions that could be cancer-related. Effective communication with our patients is the foundation of successful survivorship conversations. The more open we are with our patients about survivorship issues, the more comfortable they will be discussing them with us. Normalizing sensitive topics, such as mood, fear of recurrence, and sexual health, can encourage patients to open up to us. I've learned the important lesson not to make any assumptions about how worried patients are or what they are worried about. You just have to ask. Many survivors are overwhelmed with lingering fatigue, cognitive effects after treatment, and multiple clinic visits. By being sensitive to their range of emotions, actively listening to their responses, and validating their concerns, we help them understand our role on the care team.
I have also had a headache for 3 days. It comes and goes but never fully leaves. How do we know the cancer has not spread to my brain? Should we do a scan to check?
She has not slept well since her diagnosis, and it seems to be getting worse.
I get scared that my cancer is coming back. Sometimes I lay awake at night worrying about it. I don't want to upset my family, so I try to keep it myself.
I'm sorry you've been feeling like this, and I'm glad you're telling me about it. Cancer is a scary experience where you may feel like you have little control. Most cancer survivors go through the same feelings that you have. Let's talk about your headaches and what's worrying you so we can figure out how to best address it together. Fear of recurrence is the preoccupation with thoughts that cancer may recur or progress. It is the most common symptom among cancer survivors and can be distressing, disruptive, and isolating. People respond to these feelings in many ways. Some by requesting more tests and looking for reassurance. Some by avoiding follow-up appointments. Others by becoming hypervigilant about physical symptoms. Tell patients that fear of recurrence is common, no matter how many years it has been since treatment. This stems from a devastating life event over which they had no control. Be responsive to signs of emotional distress. If it is severe or disabling, consider referring to a mental health professional. In discussing Seema's fears that led her to request more tests, she tells us that others in her online breast cancer forum get tumor markers and other scans checked periodically. Help her understand the difference between expert-vetted information and personal stories on the internet by providing fact-based resources. Patient resources and surveillance recommendations can be found in the resource guide. After a thorough history and exam with Seema, we are reassured that the short duration and qualities of her symptoms, similar to her chronic tension headaches, are unlikely cancer-related. Validate her concerns while explaining the thought process to her and her husband, reassuring them that further imaging is not necessary at this point. Discuss signs that should prompt her to contact us again. Make sure she knows when to alert us if her symptoms do not resolve. If your headaches persist or worsen over the next 2 weeks, you need to let me know so we can reevaluate. I don't want you to worry by yourself. You can always come to me about your symptoms, and we can discuss a plan together.
Actually, I remembered one of my questions because you asked me about the new medication. Since I started anastrozole, My legs are so stiff every time I stand up. I feel like I am 90 years old. Do you think this means that my bones are weak? The pharmacist told me that bones problems are a side effect of the medication.
Explain to Seema that joint pain and stiffness is a common symptom of aromatase inhibition that is not caused by bone weakness. Encourage her to stay active, even though it may seem counterintuitive to her that more exercise and strengthening can actually help her joint symptoms. Take this opportunity to discuss bone health with Seema. Patients with hormone-sensitive breast cancer are routinely prescribed adjuvant endocrine therapy. The two classes of drugs are selective estrogen receptor modulators, including tamoxifen, and aromatase inhibitors, such as anastrozole, letrozole, and exemestane. An important distinction between the two is that tamoxifen protects bone while aromatase inhibitors accelerate age-related bone loss. Postmenopausal women lose an average of 1% bone mineral density per year. Breast cancer patients on aromatase inhibitors lose 2 to 4% per year. They are 1.5 to 5 times more likely to have fractures than women who are not receiving this treatment. Women on aromatase inhibitors are recommended to have bone density scans every 2 years to track the rate of bone loss. Discuss bone health maintenance with Seema. Ask her about calcium in her diet. Consider a vitamin D level and give her examples of weight-bearing exercises. She may also be a good candidate for bisphosphonates. Women who are at high risk of breast cancer recurrence may benefit from bisphosphonates, not only to prevent bone loss, but also to improve breast cancer outcomes. Anastrozole is lowering your body's estrogen production, which can lead to vaginal dryness or irritation, changes in libido, and pain with intercourse. Have you noticed any of these symptoms? Many patients, like Seema, may hesitate to bring up these issues or think it's just something they have to learn to live with. Even though sexual health may be important to her quality of life, she may not have been asked about it. Recommend topical vaginal moisturizers and lubricants, just as we would typically treat similar postmenopausal women. If Seema continues to have significant symptoms from vaginal atrophy despite these treatments, she may benefit from low-dose intravaginal estrogen. Encourage her to discuss this with her oncologist. Intimacy can also be affected by altered body image. Women may have trouble with the way they look or experience a feeling of loss after breast surgery. This can affect mood and self-confidence. Some breast cancer survivors have told me that they stopped activities they used to enjoy, like swimming, because they don't want to put on a bathing suit. Be supportive about these potential feelings. Many patients like Seema struggle with multiple survivorship issues, such as anxiety, fear of recurrence, and side effects of adjuvant medications. Your sensitivity and knowledge about survivorship topics and your efforts to communicate effectively with patients and their care team improve the quality of care for survivors. Seema's case demonstrates that eliciting your patient's concerns improves doctor-patient communication. Fear of cancer recurrence is common and can cause anxiety and symptom hypervigilance. Adjuvant endocrine therapies used in breast cancer affect bone health. While tamoxifen is protective, aromatase inhibitors accelerate bone loss. Cancer treatments frequently cause changes in sexual health and relationships that can impact quality of life. This concludes Seema's case. Please advance to the next case.